This is Elizabeth Brennan, and I am presenting on ICD-10 codes for my healthcare delivery project. So first I'll provide information regarding the history as well as a brief overview of ICD-10 codes. So ICD-10-CM can be broken down into ICD, which is the International Classification for Disease, 10 being the 10th revision, and CM, which stands for clinical modification. ICD is the international standard for the classification of diagnoses, and ICD-10 specifically was adopted on October 1st, 2015 to allow greater specificity in coding, and it requires a greater level of detail in patient care as well as an enhanced standard in documentation. ICD-10 codes consist of over 69,000 codes that range from medical to psychiatric conditions. And from a billing standpoint for the therapist, the PT is going to choose a primary code, which is the diagnosis that best fits the reason the patient is receiving PT services. Note that this may be different than the medical diagnosis that the physician applies that accompanies the patient to PT. The physical therapist can also choose other codes that are applicable to secondary diagnoses, and the secondary codes provide more detail with regard to medical necessity for interventions included in the plan of care. And those secondary diagnosis codes can be descriptive of complicating diagnoses, so essentially comorbidities. And those codes are the first step toward determining medical necessity. Now, ICD-10 codes are not equivalent to the movement system diagnosis, which is what we use for treatment planning, but they are used for third-party payers to have a common language for understanding the nature of the patient's disease, illness, disorder, or injury, you name it, to make determination regarding prognosis and plan of care. So structurally, ICD-10 codes are 3 to 7 digits in length. The first digit is a letter. The second digit is numeric, and the digits 3 through 7 can be alpha or numeric. A decimal is going to be placed after the third character, and then the placeholder X is used in certain cases to allow providers to code the highest level of specificity. And the Center for Medicare and Medicaid, CMS, recommends that providers use the longest and most specific codes available. Now, ICD-10, compared to the previous ICD-9 system, has the greater specificity built into the code sets to allow for a laterality and severity to be captured within the code. So now I'll speak to the impact that ICD-10 codes and any updates to the current system have on physical therapy. From a national standpoint for PT, ICD-10 is allowing for greater detail by describing dominant, primary, and subsequent encounters. Now, this coding system also accounts for external causes of injury and preventative health, as well as socioeconomic, family relationships, and lifestyle-related issues. ICD-10 accommodates the evolution of technology, and it supports the exchange of health data with other countries in the G7 who have already adopted the ICD-10 coding system, so essentially the other advanced countries healthcare-wise. So this update was not optional, and it includes details that the prior ICD-9 system lacked in order to reimburse healthcare treatments. And ICD-10 is going to allow for the expansion of codes that may need to be added, deleted, or revised. From a daily impact, certainly individual practices or hospital systems are going to have unique needs for the transition with each update to ICD-10 coding. And to be prepared for the updates and transitions, organizations should be sure to locate a copy of the newest version of ICD-10 for accuracy in determining codes. Now, there should also be updates to the electronic health record and any billing aids, making sure they're current, and then making sure the staff, so that whether that's PTs, PTAs, front office billing, etc., are aware of these upcoming changes. And then updating billing forms, and then speaking with local and national vendors, and making sure that everyone's on the same page with updates to coding. Now, again, on the daily impact, financial planning, management decision-making, and then policy and procedure development are certainly going to play into the day-to-day PT impact. So, from a financial standpoint, there should be provisions for decreased cash flow and plans for delayed claim payments in place. Now, this may not be as significant since ICD 10 has been implemented, but any future updates or move to later editions of ICD 10 coding may require this level of preparedness. And then the management should also work to reduce the administrative overhead and be sure there's enough staff available to handle the increased work volume. From a management decision making standpoint, the system updates to the electronic health records and training for that competency can have a financial burden, but the management needs to make sure that the decisions they make regarding the implementation to the update is done in time for the mandated changes. And then checking in with clearinghouse services, who may also require updates, can be important if you want the timely billing and then no delay in the billing payments and reimbursements. And from a policies and procedures standpoint, allocating time for the billers to learn the ICD 10 coding, especially in the inpatient setting, and then certainly inpatient rehab plays into that as well because there are more codes for that patient population. And then making decisions regarding vendors, making policies and procedures to make sure that all staff is aware of their role and how ICD 10 or future coding plays into their role and what they need to be aware of. And then also creating a claim rejection auditing preparedness for any potential rejections received by payers as a result of improper coding. Thank you very much.